Malik Nabers was just carted off the field after suffering this non-contact right knee injury. And in this video, we're going to take a closer look at the replays, talk about what exactly I think happened here and the evaluation coming up for the Giants' young star receiver. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. So earlier today in the NFL, of course, we saw this injury to Malik Nabers. We're going to back this up, look at this view from straight on, and essentially what we're looking at is injury to his right knee. We saw Nabers being carted off the field. It's always good when you don't see anything like an air cast being applied. We saw he was able to get some support, but get up onto the cart. No bracing or mobilization on his right knee, which is a reassuring thing. But I'm concerned, to be honest, here about a pretty significant, probably season-ending injury for Nabers. As we're looking at this play, I want you to keep an eye on his right leg. And really it all comes down to what his body, his knee is trying to do to control and stabilize itself as he goes to decelerate and plant right here in this position. If you look at any single image about Nabers' injury, this is going to be the image that matters. What are we looking at and seeing in his right knee? Number one, we're seeing that he's landing on a relatively flat foot. That's going to drive a lot of what we call ground reaction force up into the leg from the ground because of how he's landing on that side. The fact that as this play occurs, right, think about how a lot of these non-contact knee injuries occur. They're like stop, start, cut, pivot types of things, because as Nabers is coming here and landing, not only is he getting all that ground reaction force from planting, but his momentum is carrying him over that injured side. So you have this additional load coming across the body over that right knee, which is going to cause what we consider a knee abduction moment as that momentum wants to carry over, causing that knee to ultimately buckle ever so slightly inward right there. What that's going to do is put a series of forces throughout the knee that I am concerned could be an ACL tear. This is the classic position that we will see with that foot a little bit externally rotated, flat position, a relatively straight knee, and then we're going to see this ever so subtle shift of the knee going inward right there. That little motion right there is where that energy is going through the knee, and when I'm concerned, an ACL tear could have occurred. Now, one thing we don't classically see on this view is that recoil, right? So remember, the ACL is trying to keep the tibia stabilized from going forward or anterior relative to the femur. And sometimes when you look in slow motion with an ACL rupture, you'll see the tibia go forward and then pop backwards. We don't see anything like that in this view, but let's take a look at a couple other views to try and see if we can observe anything there. So this view from behind, we see a similar overall picture, right? We're still keeping an eye on that right knee. As he goes to come down here, we see that foot land relatively flat, and that foot, again, externally rotated relative to the femur and the tibia. We're then going to see this little moment right there where that knee buckles inward, and what that's going to do is put that rotational force through the knee, which can lead to the ACL tearing. Now, what we're again trying to see is if we can pick up any sense of like a recoil. As he comes up here, it does look like right about here, there's maybe a little bit of a motion backwards in the knee. It's pretty subtle. I don't think it's really clear and obvious like we will see with some other injuries, but still concerning, of course, for that ACL. Maybe right about there. You could kind of see as he gets up a little bit higher here, pay attention. So there, tibia is a little bit forward still, and then maybe right there coming back a little bit. I don't see any recoil or snap in the Achilles. I don't see anything like that in the gastroc, but really, again, this position right there, that's what is classic for an ACL injury. Thinking a little bit more too through the biomechanics of this. So in this position, right, he's decelerating. I talked about all that momentum carrying him over that injured side. What's really important biomechanically for the knee here is that the hamstring is going to try and be compensating for what the ACL is also passively trying to do. So here in this position, as he's landing, remember, there's all these forces going through the knee that make that tibia want to go forward and rotate. The hamstrings are sitting on the back side of the thigh, and the hamstrings are going to fire and actually pull the tibia posterior. It's one of the big reasons we talk about like hamstring strength, hamstring neuromuscular control with ACL injury reduction programs and rehab, is because the hamstring is the active stabilizer counteracting what we're concerned about with the ACL. And so in that position, as Nabers is landing, his hamstrings are trying to do what they can to fire, to stabilize the joint, to prevent that anterior tibial translation, but unfortunately it does not look like they are able to. Other things, of course, to think about here with an injury like this, anytime you're landing and kind of trying to push off or stabilize yourself, obviously something like the patellar tendon, something like the quadricep tendon is going to be on the differential. I don't see any displacement. Here we can see his patella outlined pretty clearly. Sorry, let me move that over. Here we don't see any displacement in the patella. It looks like everything is in a reasonable position. Again, we didn't see him put in a knee immobilizer, which you would do if somebody had a patellar tendon or a quad tendon injury. So again, still in the differential here, but not not going to be as high for me as an ACL. And then finally, here as we see him being taken off on the cart, again, the knee is not an extension. If this was a patellar tendon rupture, quad tendon rupture, he'd be locked out an extension, meaning the knee would be straight. Sometimes, remember, with these ACL injuries, you can have a meniscus tear. Sometimes that meniscus can flip or get stuck in a position that makes the knee want to stay bent. And so there are other internal injuries to the knee that could go along with an ACL, MCL, of course, being one, cartilage injuries. But again, seeing him going off on the cart here without anything immobilizing his knee is what makes it less likely in my mind for something like a quad tendon or patellar tendon injury. So let's back this up, look at it all again one last time, kind of in the full replay here. Nabers goes up, he tries to stop and plant on that right leg. His momentum is unable to adequately decelerate in a way that can stabilize things around the knee. As he plants and lands, we're going to see relatively flat foot. We're going to see that knee buckle a little bit slightly inward from that knee abduction moment as his energy carries him over that injured side, likely when I'm concerned about an ACL injury. We'll await final updates here for Nabers. If we get anything new to report that adds to the conversation, something different, unexpected, we'll be sure and do an update here. But again, looking at the replay, my initial first concern is unfortunately for an ACL. That's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.